Hey everybody. I am now about 17 days post-op. This is my chest. It looks really good. You can still see the incisions have a nice healing ridge, which is normal and expected. Cat. Um, at this stage, the nipples, they look really good. You can see. Um, the edges of them are nice and healed. You can't, this one uh, for a while was looking pretty rough around the edges, but is completely healed now. The main reason I wanted to make this video was to show you how I massage to try and keep the healing going. I use two different products. I use avocado oil, which has omega-3, 6, and 9 acids in it, and vitamin E. This is my natural oil. I am a hippie at heart, and this is what I use. And I alternate it with a silicone product, and pretty much all silicone products are the same. You can use some of those expensive scar oils, or you can just go out and buy a silicone lube. And my personal preference of lubes, um, it happens to be wet platinum, and that's what I had on hand anyway. And if you read the active ingredients in this, it's dimethicone and cyclopentazolene, um, and phenyltrimethicone. But I think the phenyltrimethicone and the uh, dimethicone are the two main ingredients that are in the scar oils, the scar silicone-based oils. So basically what you're getting in the silicone lubes is exactly the same thing that you're getting in the scar oils, but only like half the price. So save yourself some money and get something like this. This is made to use on delicate skin, and so is the scar oils. So what I do is I apply just a really small amount. That's not even a dime-sized amount. And I rub it all along the incision there. I don't get it on the nipple at this point because I'm not even 3 weeks out, and if I were to rub vigorously on the nipple at this point, I could actually damage that graft. It's still too tender. I mean, I can go like that, but if I were to rub vigorously against it, that could injure me. But the scar, I can work as vigorously as the pain will allow. And depending on whether or not I've taken ibuprofen recently, I mean, I can work this thing, quite vigorously. Wherever there's a knot or a bump from a suture, I'm going to work that harder. Because the more vigorous the massage, the better the healing is going to be. And so I do this on both sides, pretty firm. And afterward, I'm going to tape it up with scar tape. I have uh, mepicone, I think. I'll put it under, and you'll see what it's called. The other thing that I do, because I have a little bit of elongation in the nipples, is I take and I massage upward. And I also put some either silicone or avocado oil in my skin when I do this. And then I massage downward, bringing it in this way. This is a little painful because of the lipo that I had here, so I'm a little more gentle here, and then this way. And you can see when I do this, my nipples straighten out to a little bit rounder than they are now. And this should encourage some growth of tissue and hopefully make them not stretch so much. Alright, there you go.